Nabilone, 0.25 milligrams, costs 1.64 Canadian dollars for one tablet. Dronabinol, or THC, costs $2 for one 2.5 milligram tablet. And medical cannabis through the program at Health Canada costs $5 for 1 gram of cannabis. Since cannabinoid medications have been available on prescription in Canada, there has been a tremendous increase in the number of patients using these medicines. This graph shows you the number of prescriptions since 2005 written for cannabinoid medications over the last 5 years. And you can see that there has been a steady increase in the number of prescriptions. It may look like a lot, but this is a very small number of prescriptions compared to the total number of prescriptions written for medicines in Canada, and does not represent a significant market at this time. However, the trend is for increasing awareness and increasing numbers of patients being prescribed these medications. The reasons for prescribing these medications go beyond the indications for which the medications were approved for sale in Canada. Most of the prescriptions now are for uses outside of the indications of nausea and appetite stimulation. They include pain relief, they include sleep, they include psychiatric indications such as anxiety and bipolar disorder. So what have we been doing to establish research in Canada? The first thing we did was to understand who the patients are that use cannabis as a medicine. Why do they use cannabis? How much do they use? When do they use it? And where do they get the cannabis from? With this information, we were able to design a clinical trial using smoked cannabis as a treatment for neuropathic pain. As you heard from Professor Notka, this is one of the conditions which is most difficult to treat in pain management. It represents a significant burden on our society, and there are very few effective medications available for this. It was also one of the reasons why patients told us they were using the drug. The Canadian Health Funding Agency, the federal health agency that funds research in Canada, called the Canadian Institutes of Health Research, provided $250,000 Canadian dollars to do this trial, and the results will be published in August of this year in the Canadian Medical Association Journal. The second study, which was implemented, was to address the concerns that long-term use of smoked cannabis may have negative health effects on patients using the drug in this way. We were funded by the Canadian government for $1.8 million to conduct a long-term study of the safety of cannabis when used in this way. I will share some of the preliminary results with you this morning. And I will also share with you some very simple research studies that have been conducted with other cannabinoid compounds. But first, the epidemiology. Who is using cannabis and for what reason? This table shows you some of the conditions for which cannabis is well known to be used by patients, and some information regarding the proportion of patients attending clinics who use cannabis as part of their medication. HIV/AIDS, epilepsy, chronic non-cancer pain, and multiple sclerosis have been well studied for these conditions. And you can see the the proportion of patients who use cannabis ranges from 15 to 40% for HIV clinics, about 20% in epilepsy clinics, and between 10 and 15% in multiple sclerosis and chronic pain clinics. These figures are a surprise to many physicians because they don't know that their patients are using cannabis as part of their treatment, unless they ask. I'm going to ask you a question. What reasons do you think these patients are using for cannabis? Is there any suggestion? Please raise your hand if you think you know why the patients are using cannabis in these conditions.
Because it works. Because it works.
Because it works. That's a very quick answer. Because it works for what?
For a lot of conditions mentioned yesterday.
Such as?
Such as pain, such as mood disorders,
Mood disorders.
such as...
Maybe somebody else can have a turn. Yes. To manage side effects of other medications. Any other conditions? Anxiety. Any other conditions? For pleasure? Is this a medical use or is this a non-medical use? Any other conditions that people would use cannabis in these populations? It was clear from our studies that patients used it for pain, sleep, and anxiety as the primary reasons. Pain was not always the major reason. Very often they used it to help them sleep at night or to relieve stress. The doses that we used in these patients were often quite small. Patients who use cannabis as a medicine use very low doses. They use it only sufficient quantities to treat and alleviate the symptom that they are seeking to treat. As a general rule, patients using cannabis as a medicine do not use enough to generate a euphoria or a significant high. This is the goal of a recreational user, to feel euphoric. For a patient using cannabis as a medicine, the goal is to return to some form of function, to be able to go about their daily lives with as little symptoms as possible. The other reasons included the treatment of seizures, the relief of spasticity, as a way to reduce the side effects of other medications, and as a way to reduce the use of narcotic medications such as opioids. Our clinical trial was conducted on the basis of these results. We used very small doses of smoked cannabis, and as Professor Notcutt pointed out, using cannabis in a cigarette, which is the classical way that people use cannabis recreationally, is a very difficult way to standardize the dose that is delivered to a patient. We developed a method by which patients used a small pipe, a device which delivers a small quantity of cannabis in the bowl of the pipe, and the patient can smoke a single inhalation 3 times a day. This study used 4 different types of cannabis. A placebo, which had no THC, a low dose, which had 2.5% THC, a medium dose at 6% THC, and a high dose of 9.4% THC. At the time the study was conducted, these were the highest strengths of cannabis that we could have available for legal clinical research purposes. I may remind you that cannabis that is available on the street in Canada varies between 10 to 15% THC and sometimes even higher. So these patients used 1 inhalation of smoked cannabis 3 times a day for 5 days, after which they would stop using cannabis, they would wash out and not use any cannabis for 9 days, and they would come back into the study and then use one of the other 4 preparations. And they were randomized to receive these 4 preparations in an order which neither we as physicians or the patients knew which order they were getting the treatment. At the end of the study, we asked the patients if they knew which one they had received. And while early in the study, the subjects couldn't differentiate between the strengths of THC, by the end they were able to tell which one was the high dose and which one had been the low dose. But the effect on pain, which was the primary outcome of the study, was significant. And the high dose THC group showed reduction in pain compared to the placebo. And there was a trend towards improving pain reduction as the dose of THC was increased. I remind you that these were 3 inhalations of smoked cannabis per day for 5 days. This is not a large exposure to cannabis.